government doctors at Corvar, the Patanjali Hospital and Corvar Institute of Medical Sciences. These doctors were trained to handle coronavirus, are said to be escaped from performing their duty yesterday. That is the news which I have seen in the TV yesterday in the media. If that is true, if the doctors have escaped their duty in performing a national duty, we must see this in two angles. One is the doctors, the qualified doctors escaping their duty calls for an emergency situation in India. That is to say, there is no medicine and all the medicines which is presently being used is not working out. Second, their safety, the doctors' safety and security should also be looked into. Suppose, see, we have very minimum doctors in compared to the population. If all doctors get infected and they start dying, which we have been witnessing after the outbreak of coronavirus, they are the doctors or the frontline people who are working on doctors and the medical staff or the frontline sergeants, people working to save lives. If they are infected with the COVID-19 virus, if they collapse, then the entire India will collapse. Their lives are very valuable for us, for our country. The lives of doctors, medical professionals, paramedics, they're all very important. Nurses, they are the life saviors. Therefore, it is also the responsibility of the government to secure their security, their safety first. The personal protection kits must be of the highest standard. They must be first given all protection. The sanitization, the cleanliness in the hospital, the equipments in the hospital, and all emergency necessary medical life-saving equipments must be provided at the hospital, at the government hospitals or at the private hospitals. It becomes the duty of the government to secure their interests first. The fleeing of doctors from performing their duty is like fleeing of the soldiers from the war. So that shouldn't happen. That is very dangerous trend. In case if the soldiers are not equipped, if they are not trained, if they do not possess the weapon, necessary arms and ammunition to fight the other country in a war, it's quite but natural after seeing some deaths they will return back. They must be equipped. Just like that, the doctors must be equipped with sufficient immediate necessities. They must be given security, they must be given protection. The PPEs must be ensured, the personal protection kits, doctors' personal protection kits and the paramedical medical staff's personal protection kits must be provided in large numbers. It must be easily available to the doctors. Their confidence level must be enhanced. So these are the two things. One is there is a failure of doctors to perform the national duty. That is one side. The other side is there should not be a failure of the government to boost their morale in the time of crisis. Because unless the medicine is found out, the vaccine is found out for this deadly Chinese virus, that is COVID-19, even this lockdown is not going to work on a long run. 1 month, 2 months, say 3 months and 6 months, then what? So the government must in fact focus on the scientists, on development of the medicine simultaneously. This lockdown is the immediate measure. There is no other go. So this is one of the excellent measures that government has adopted for time being. So this cannot be a permanent solution. Lockdown can never be a permanent solution for a virus like this. Even after 6 months, if the lockdown is revoked, let us say, we do not know when the lockdown is going to come to an end. So considering that another 6 months the lockdown continues. So in spite of all that pain and suffering of the people because of the lockdown, immediately after the lockdown is released, if this pandemic catches, it spreads, then what is the solution? Therefore, it is the duty of the government to concentrate on the scientists who have come forward. There are many scientists in India have come forward that they will on the verge of finding out medicine for the vaccine for this pandemic. So they must be encouraged. The entire focus of the government should be there. Alternatively, along with these lockdown measures, temporary measures, the permanent measures like invention. So India has a number of scientists. Their intellectual capacity is renowned in the world. The doctors of India are renowned. They're very popular. They're very famous. Their integrity is next to none. Their knowledge is next to none. The scientists, always Indian scientists have enshrined the entire world because of their intellectual capacity. So therefore, invention, when the scientists have said that they are on the way to invent vaccine for the medical solution for this COVID-19, the entire focus of the government should be there. So until unless the temporary measure of lockdown is appreciable, but this cannot be a permanent solution. Therefore, the doctors presently who are fighting the coronavirus patients, who are suffering from coronavirus patients, must be given proper protection equipments. The environment must be made conducive. They must not be allowed to the dangerous circumstances, dangerous surroundings, so that they will be infected. See, as as a part of duty, if they get this pandemic, this epidemic spreads to the doctors or to the frontline medical professionals who are treating the patients, that is a different thing. But without preparation, if we push the doctors to perform the act, then because of inefficient, insufficient, negligent attitude of the hospital authorities, that is the government, hospitals, the government, then the entire responsibility has to be borne by the government. Therefore, they must have a special task force who must ensure that doctors are given proper PPEs. And also the government, the Prime Minister, our most honorable, respected, performing Prime Minister should also focus. See, he will be doing the task, the government is doing the task, it is known, but still, as a duty of a citizen, it is also our duty and responsibility to remind, to revive the thoughts of the government in such a critical situation. Therefore, we must set right our duties, our focus first. First thing is this: I suspect you of coronavirus, you suspect me of coronavirus. That is the lockdown. So I don't touch you, I don't come near you, you don't come near me. This is one thing. So that will carry on. But this cannot be a long-lasting solution. So there must be, until unless there is a medicine for coronavirus, there can be no solution at all, even after 6 months. Therefore, the government should first focus on the scientists, the doctors who are trying to come out with a vaccine or with a medical solution, a system, a procedure, treatment procedure. They must be given full focus, they must be given protection, they must be given the necessities in their research and development. Second, the doctors, the frontline medical professionals who are treating the coronavirus patients who are infected by coronavirus, this COVID-19, they must be given proper PPEs. The surroundings, the environment in the hospital and the doctors should be made conducive so that they perform their duty with safety and security. Because all said and done, fleeing from the duty looks very cheap, and it brings it defames the profession of the medical, the entire medical fraternity. At the same time, it is also the duty of the government to take care of each and every medical professional and give them the necessities in such an emergency.